there's many things that affect the look of the breast, right? Weight fluctuations being a major one, but also the health, sun exposure, pregnancies. There's a lot of things that can impact it. Often, the implant is the most stable portion of the breast. It's the most unchanging portion of the breast, but there are real people who continue to change. So we have to always look at the whole picture to finally see, how the longevity is going to be and how long it's going to take until we maybe want to intervene and do something else, which is usually not about the implant, it's about other things.
Once you're healed after surgery, there's not really any maintenance or anything that you really need to change. When implants are placed under the muscle, I do caution patients from doing too many pec exercises because that pec movement will displace their implant. And I do tell patients that wearing some type of supportive bra is always a good idea because your breast is essentially a weight and you're going to continue to age and gravity will keep pulling things down as it does when we age. And so the more support you have for your breasts, the better the long-term result.
I think it's really important to choose a surgeon that understands the longevity of implants and works with companies that have been around and have data to support their product. The other thing is to size the implants appropriately so that they're not placing too much stretch and stress on your skin. Post-operative care is so important with actually wearing bra support to support your implants and your breasts over time. The FDA makes a statement every year saying that implants are not permanent and they are meant to be replaced, and that's very important to consider as well.
Picking the right implant that fits the frame, that isn't oversized to create problems along the way, that you massage them appropriately and do all the things that we ask you to do. We even actually give our patients some vitamin E or even some medicines to reduce the risk of capsular contracture in those first few months. I also don't have my patients get dental work for the first 6 months after surgery. All the things that we think may introduce bacteria into an environment where we're trying to heal a breast augmentation. So there are some things that we actually do in a really real way to try to reduce any problems with it. On the other hand, you have the long-term effects, which long-term an implant could rupture. It could get a capsular contracture, so you don't want significant trauma to your chest or your breast. That can create problems